Dr. Professor Paolo Bonanni, who is Director of Postgraduate School in Hygiene Preventive Medicine, University of Florence Medical School. We'll talk about the Calendario per la Vita, Calendar for Life, Vaccines for Adults and Children, Instructions for Physicians and Pediatricians.
One sec. Rob, you're leaving? You will be leaving in an hour. So if there is any pressing question, sorry to interject. If there is any pressing question to Rob before he leaves, he will have no substitute. As you know, like the Porsche, he has no substitute. So, yes. Presidente, prego. Rob, you gotta come back to the stage 1 second.
Before going back to the stage.
Or he will give you the mic.
No, I just, 2015 is only in 2 months, okay? And I'm really worried about this goal of 2015. Do you think it's realistic, or do you think that we are going to postpone it again?
I think the data tell the story, and I'd actually like to turn that question over to my 2 colleagues from ECDC and WHO Euro, because I think they know best, but I'm pretty sure they're going to say the same thing I'm saying.
2015 is just around the corner. That target is certainly under threat. We're still of hope at the moment that it will be met. We're still standing by the target. It looks like the Regional Verification Commission that meets just in 10 days' time will deliberate and discuss what the next step is in the case of a Plan B in terms of the elimination goal for 2015 and the scenario if it's not met. It does not look at this point as if a new target date will be set. I think instead we've got to focus on the something that we didn't do very well in 2010, which was to tell the story, because actually we have come a long way. There are countries, many countries, and even blocks of countries that have more or less eliminated measles. And we're not telling those stories. We're not maybe using advocacy messaging as well as we could to the remaining countries that are underperforming. We've just gone through a process now of developing a matrix where we're looking at the top sort of 8 to 12 countries that are countries of most concern, if you like. And I think now our attention has to be on those countries. And we have to be a bit more harder, if you like, as a community, with placing more political pressure upon those countries to perform. And that's not only in terms of commitments in terms of resolutions, but it's also in terms of ring fencing, protecting their budgets, building those budgets, and maybe packaging our messages slightly differently, because the decision makers in many of these countries are not the same decision makers that are signing these bits and pieces of paper that go through various resolutions. The actual decision makers on vaccination often are in another department, are in another ministry, are the people who hold the purse strings. And I don't think we've done a good enough job of tackling them. So this is a very long-winded answer to your question, which is not an easy one to answer. But there's still hope. But the time is now to look at what a Plan B will be if we don't make it. But it's clear that we want to stand by an elimination goal. Did you want to add to that? Did you want to add to that? Okay.
Yeah, I just wanted to follow up and say that one of the lessons learned from the polio program, I think it was John Ryan who this morning mentioned the independent monitoring board for polio eradication that meets on I think 3 times a year basis. They just came out with a report 2 weeks ago, and basically they said, well, there's been great work done in Nigeria, not so great in Afghanistan, and a really bad job in Pakistan. But what we're really worried about is all the countries that are polio-free, but at high risk of having imported virus and an outbreak. And I think that there's been so much effort focused on countries where virus is circulating, the countries where the risk is more silent. it has put us in a fairly dangerous situation, and I can see the same thing happening in Euro. I think with these pockets of low immunization coverage, I bet you've got lower immunization coverage across the board, not in pockets, and that's disturbing.
Good. Now we can go ahead with the program. You have the floor.
Thank you very much. Thank you, Dr. Wright. Thank you, Professor Pani. I wish to thank the organizers of the meeting, the Ministry of Health, and particularly Professor Sergio Pecorelli for inviting me to be here to present a very nice experience of collaboration among different scientific societies. And we do hope that our example can be a paradigm also for other European countries in this field. What is a vaccination calendar? A vaccination calendar is the chronological description of timings when vaccinations need to be administered starting from birth until elderly age. It is a useful guide for pediatricians, general practitioners, and parents, but it mainly represents a tool to make immunization strategies operational and reach the objectives of different vaccinations. How the whole story started. So we started in 2010 when the Italian Society of Public Health issued a vaccination calendar for adult age. At that time, vaccination was still considered mainly a problem of childhood. So except for influenza vaccination, all the rest of vaccination were not very popular for the adult and elderly age. And we did not invent anything because in the United States there was already a calendar for elderly, for adult age, but we adopted that and adapted it to the Italian situation. So we issued a calendar where you have the recommended vaccination by age, like you see here, and in yellow we have the vaccination that are for all people under that age group, and in blue you have the vaccinations that are recommended for people in those age groups with particular condition or chronic conditions. But we also had a table where we specified all the vaccinations that are needed for specific conditions of illness or conditions of life, like travelers or healthcare workers and so on. There was a big impact of this vaccination calendar for elderly people on the media, because I've reported here a page of the most popular newspaper in Italy, which is the Corriere della Sera, where the title was "Vaccine for the Young Elderly." And so, and it was repeated even in another page some days later. So we had a big impact on the media and on the journals. What was the impact of the vaccination calendars proposed by the scientific societies on the National Vaccination Plan 2012-2014? We can say that although our intent was a scientific one, we can say that the contents of the calendar for these groups are almost identical in the National Vaccination Plan to the updated adult elderly calendar of 2011 of the Italian Society of Hygiene. And the part on immunization of healthcare workers is perfectly overlapping. It's the same. There is, on the other hand, a missed opportunity in the National Vaccination Plan 2012-2014 because the National Vaccination Plan did not introduce the concept of lifetime vaccination calendar. And I think that this should be addressed in the forthcoming, in the next National Vaccination Plan 2015-2017. And we arrive at 2012. In 2012, we issued the first version of the Calendario Vaccinale per la Vita, so the lifetime vaccination calendar, a vaccination calendar that was proposed by a coalition of scientific societies and professional organizations of physicians with the aim to offer an immunization plan from 0 to 100 years, and even more if one survives. What is that? I think that the scientific and professional societies define in this way the best practices for healthcare workers and the public on vaccination. So the vaccination calendar is meant to coagulate the scientific world and healthcare practitioners, public health, pediatricians, general practitioners, to propose the best possible immunization schedule, updated regularly, following the most recent discoveries and scientific evidences. We had no intent to substitute public health decision makers, but rather to offer a strong support initiative for regional health authorities to possibly integrate the vaccination offer guaranteed as essential level of assistance by the National Vaccination Plan, but also, and mainly, an important guide to doctors and nurses on what to inform about and to propose in the interest of population health from an individual point of view. The four societies are listed here. They are the Italian Society of Hygiene, Preventive Medicine and Public Health, CITI, the Italian Society of Pediatrics, SIP, the Italian Federation of Family Pediatricians, FIMP, and the Italian Federation of General Practitioners, FIMG. I can say that altogether there are more than 20,000 healthcare workers and practitioners in Italy, so it's a huge number. What was the calendar of 2012? 2012, we issued this calendar, and here you can see with the red circles what we added to the National Vaccination Plan. I will tell you later on a little bit of the news, the new proposal that we added in the 2014 calendar. So in a way, making a joke on the words in Italian, it's not easy to translate into English, but we have the calendar dei LEA of essential level of assistance, and from the other side, if you make the combination of the letters, it's the ideal calendar. So the calendar of essential level and the ideal calendar. What were the interim activities between 2012 and 2014? We worked hard even in between the two versions of the calendar, because in 2013 we issued the indication of the lifetime vaccination calendar board on anti-pneumococcal vaccination in at-risk subject, because at the time there was the new PCV13 vaccine for pneumococcus, and at the time there was no indication by the Ministry of Health on whether to use the PCV13 or the PPV23, and so we tried to overcome this problem and to give to the healthcare practitioner a clear indication on how to use the vaccine. And then last year, December 2013, we also worked hard on a proposal of vaccination calendar for the newcoming MAN B vaccine, meningococcal B vaccine, and so we proposed where to put it inside the vaccination calendar. So also this was used by many regional health authorities to build their regional plans. And this is the picture of the 2014, the last approved version of the calendar. You can see here we first represented it just 1 month ago in our congresses of the different societies taking part to the board of the calendar. It's obviously I will not go into the detail because it would be technically a little bit difficult and it would take a lot of time. But I would only like to stress some aspects of the calendar 2014. This is from the rationale we wrote. 2 years after the first edition, we can say that the lifetime vaccination calendar reached many of its objectives. Actually, it has become, first, a reference document for national, regional, and local institutions, being explicitly cited as the basis for new deliberation of regional vaccination plans. It was also a guidance document on the best practices of vaccination offered to the public, the object of refreshment courses and meetings for doctors, nurses, and public health nurses, and the other healthcare workers involved in the vaccination practices, an example of collaboration among different scientific and professional societies. Furthermore, it should be emphasized that the Italian law 189 of 2012 recognizes that those who perform a healthcare profession and apply guidelines of good practices accredited by the scientific community do not respond under the penal law for a light negligence. Substantially, those healthcare workers who follow the indications of the lifetime vaccination calendar, if found professionally responsible, will only respond for a serious negligence. Such disposition represents a further prompt for scientific societies who, while defining good practices, realize an effective preventive and judicial tutorship for all professionals involved in the vaccination world. What are the innovative aspects of the lifetime vaccination calendar 2014? Let me list them just, if you want, we can discuss them later on. The introduction of a DTaP IPV vaccination as a booster at adolescent age, and also the decennial booster with the DTaP. The introduction of PCV13 pneumococcal vaccine conjugate to one or more age cohorts over 65 years of age and to risk subjects at any age. The universal meningococcal B vaccination in infancy with a 3+1 schedule if started early, or 2+1 since month 6 of age. A dose of quadrivalent meningococcal vaccine to all adolescents, both as a first dose but also as a booster, because it's very important also to give a booster at that age. Alternative, and also an alternative to administration of MenC in the infancy. Universal varicella vaccination of toddlers with MMRV or MMR plus V, with the indication of the possible co-administrations with the MenB, MenC, and quadrivalent meningococcal vaccine. The extension of HPV vaccination offer to at least 2 female age cohorts and to 12-year-old males. Universal rotavirus vaccination. Zoster vaccination to at least an age cohort of elderly and to all risk subjects, and it's not listed here, but also the decrease of the age of offer of vaccination against influenza to 60 years, because in the age group 60-65, 20 to 30% of people are already with a chronic condition, so it's much easier to give a universal vaccination at that age than looking for each single risk factor in the subjects. What was the impact of this calendar 2014? We already had the impact, because if you look at the calendar of region Puglia in Italy, in southeastern Italy, you can see that what is the figure here is almost assuming all the decisions that were proposed in the vaccination calendar. So we already have one region that does almost everything that is listed there, and also the recent calendar for the Veneto region is almost overlapping with the proposal of the vaccination calendar for life. So you see that it's not only a scientific exercise, but it's deeply influential on the decision of regional health decision makers. I would like to stress something that has already been reported today, but the total drug expenditure in Italy in 2011 was 26 billion euro, 75% of which charged to the National Health Service. The total expenses for vaccines, all of them including influenza, including elderly vaccination, was about 310 million euro, 1.2% of the total drug expenditure and 2.5% of that of the National Health Service. The per capita expense for all vaccines was around 5 euros. As a comparison, the per capita expense for atorvastatin was 7.9 euro, and that for protonic pump inhibitors was 14.8 euro. So I think that it's clear that it is the expenses sustained to buy all vaccines represent a residual fraction of the overall drug expenditure, and that such expenses should not reasonably be subject to any cut, even in a period of extremely hard economic conditions like the one we are experiencing. But do not let us forget also the global objectives of vaccination program, and I would like to end reminding to ourselves that we have to run a European Vaccine Action Plan 2015 and 2020, and we are ready to start, and we are enthusiastic about this engagement with some very clear goals: sustain polio-free status, eliminate measles and rubella, control hepatitis B infection, meet regional vaccination coverage target at all administrative levels throughout the region, make evidence-based decision on introduction of vaccine, and achieve financial sustainability for national programs. I would like also to remind that there is a technical and advisory group of experts at the European level at the WHO Euro. We met last October, beginning of October, and our role is independent review and technical input into WHO Europe's vaccine and preventable disease and immunization programs, and we will help also to steer implementation of the European Vaccine Action Plan in 2015-2020. A final wish, and it's really my last slide. Italy has received a commitment from the international community in the field of vaccination strategies. WHO Euro strongly requests the presence of a National Immunization Technical Advisory Group, the so-called NITAG, in every country to make EVAP, the European Vaccination Plan, operational and monitored. We do hope, as scientific societies of the calendar for lifetime, that a National Vaccination Commission, which was discontinued in 2008, will be soon reinstituted in Italy. I think this is something that Italy, as a leader in the international community, cannot miss. And with this, thank you very much for your attention.